Imagine feeling constantly tired, bruising easily, or suffering from pain that won't go away. These might seem like random symptoms, but they could be signs of a serious illness, one that often hides in plain sight. Acute lymphoblastic leukemia, or ALL, is a type of blood cancer that affects people of all ages, though it's most common in children. And while it might not get as much attention as other forms of cancer, ALL is aggressive and needs quick action. In this lecture, we're diving deep into what ALL is, why early diagnosis is crucial, and the steps involved in treating it. By the end, you'll have a clearer picture of how ALL works and how to take proactive steps if it affects you or a loved one. Section 1. What is acute lymphoblastic leukemia? Acute lymphoblastic leukemia, or ALL, is a cancer of the white blood cells, specifically affecting cells in the bone marrow where blood cells are made. This type of leukemia develops when a damaged stem cell transforms into a leukemic cell and starts to multiply rapidly. These abnormal cells, known as leukemic lymphoblasts, crowd out healthy cells, disrupting the body's natural balance. Without enough healthy cells, your body struggles to function properly. You might experience unexplained bruises, intense fatigue, or even sudden fevers. These symptoms can be easily mistaken for other conditions, so recognizing them and seeking medical attention is key to diagnosing ALL as early as possible. Section 2. Symptoms of ALL. ALL can manifest with several symptoms, and because these symptoms are somewhat general, it's easy to overlook them. Let's break down some of the most common signs. 1. Easy bruising and bleeding. Since ALL affects your bone marrow, your body produces fewer platelets, which are essential for blood clotting. You might notice more bruises or experience bleeding that's hard to stop. 2. Fatigue and weakness. With fewer red blood cells circulating, your body struggles to get the oxygen it needs, leaving you feeling weak and exhausted. 3. Fever and infections. Because ALL weakens your immune system, fevers are common. You might also find yourself battling infections more often and taking longer to recover. 4. Bone and joint pain. As the leukemic cells spread, they can invade your bones and joints, causing persistent pain. While these symptoms don't necessarily mean you have ALL, they are important red flags that shouldn't be ignored. Section 3. Causes and risk factors. So, what causes ALL? The truth is, we don't fully know. ALL results from a genetic mutation in a stem cell, which then begins to produce leukemic lymphoblasts. However, certain factors can increase your risk. Age. ALL is most common in young children and in people over 50. Radiation exposure. High levels of radiation, either through past treatments or exposure, can elevate risk. Genetic disorders. People with genetic conditions like Down syndrome or those with a family history of leukemia may face higher odds of developing ALL. It's essential to remember that these factors only increase risk, they don't guarantee someone will develop ALL. Section 4. Diagnosing ALL. Getting a diagnosis early can make a huge difference. Here's how doctors typically diagnose ALL. 1. Medical history and physical exam. A doctor will start by asking about your symptoms and any relevant family history. They'll also check for physical signs, like swollen lymph nodes or pale skin. 2. Blood tests. A complete blood count, CBC, measures white and red blood cell levels, as well as platelets. Abnormal counts could indicate a problem. 3. Bone marrow biopsy. If blood tests suggest leukemia, a doctor may perform a bone marrow biopsy. This involves taking a sample of liquid marrow from the hip bone to check for leukemic cells. 4. Additional tests. To see if the cancer has spread, doctors might order a spinal tap or imaging tests like X-rays or ultrasounds. Section 5. Treatment options for ALL. The primary treatment for ALL is chemotherapy, which is administered in 3 main phases. Remission induction. In this first phase, the goal is to eliminate as many leukemia cells as possible and to get the patient into remission. This phase usually involves powerful chemotherapy drugs like vincristine and prednisone. It's an intense month, but getting to remission is a huge first step. Consolidation. Once in remission, the consolidation phase uses a shorter course of chemotherapy to target any remaining cancer cells. Some high-risk patients may need a stem cell transplant during this phase. If this is necessary, the doctor will explain the procedure in detail so the patient can make an informed decision. Maintenance, the final phase, aims to prevent the cancer from returning. This phase is longer, often lasting up to 2 years, and involves lower doses of chemotherapy medications like methotrexate and 6-mercaptopurine. This ongoing treatment helps keep all in check and reduces the chances of relapse. In addition to chemotherapy, some patients might need other treatments to prevent leukemia from spreading to the central nervous system. These additional treatments vary based on the individual's needs. Section 6. Outlook and survival rates. The outlook for all varies based on age, overall health, and how early treatment begins. For children, the survival rate is relatively high, with around 85% surviving at least 5 years post-diagnosis. In adults, however, the prognosis can be more challenging, especially for older adults. Studies show that people between 60 and 69 have a 5-year survival rate of about 22%, while those over 70 have a 5-year survival rate closer to 5%. Factors like a person's age and general health, as well as how well their body responds to treatment, influence survival rates. Although these numbers can seem daunting, early diagnosis and treatment greatly improve the chances of a positive outcome. Section 7. Living with all and moving forward. Living with all is not easy, but with the right support and treatment plan, patients can manage their condition and, in many cases, achieve remission. Here are a few tips for managing life with all. Stay informed. The more you know about your condition, the better equipped you'll be to make informed decisions. Follow your treatment plan. Sticking to your chemotherapy schedule is crucial, even when you're feeling better. Every phase has a purpose, so staying the course is essential. Lean on support systems. Friends, family, and support groups can make a tremendous difference. You don't have to face this journey alone. Conclusion. Acute lymphoblastic leukemia may not be one of the more commonly discussed cancers, but it's one that deserves our attention. Knowing the symptoms and understanding the treatment process can help you or a loved one take action if the need arises. While living with all presents its challenges, the right information and timely treatment can make a significant difference in the journey ahead. Remember, your health is a top priority, so stay informed, stay vigilant, and don't hesitate to seek medical help if you're experiencing any of the symptoms we've covered today.